Hi everyone, thanks very much for joining us today on this session that we're doing about HRT. Now, since we launched a couple of weeks ago, we've had lots and lots of questions about HRT. Everything from what is it, should I take it, what are the side effects, will it cause cancer? So I'm really delighted that Claire is joining us today to talk all about HRT and to answer your question. Now, Claire is eminently qualified to help you in this area. She's a registered menopause specialist and GP, has treated hundreds, if not thousands of women over the last few years. So welcome, Claire.
Hi, thanks, Helen.
So Claire, why don't we start with the first question, which is, what is HRT? What does it stand for and what does it do?
HRT stands for hormone replacement therapy, and it's usually two hormones. So that's estrogen and progesterone. When we go through the menopause, our ovaries stop producing estrogen, and it's the loss of estrogen that's responsible for most of our menopause symptoms. And so the key hormone in the HRT is estrogen. The issue is that if you still have your womb, so you haven't had a hysterectomy, and you take estrogen by itself, it can thicken the lining of the womb and down the line increase your risk of womb cancer. And so that's why you need the second hormone called progesterone to keep the lining of the womb thin. If you have had a hysterectomy, obviously you only need the estrogen.
Okay, that's really, really helpful, Claire. So am I right in thinking that really when we take HRT, we're replacing the hormones that our body is losing because we're going through the menopause transition?
Yeah, I think that's a really good way of thinking it. So in the perimenopause, for example, that's the period of time when your ovaries aren't working quite so well as they did before in the premenopause. You might still have estrogen floating around, but the levels can fluctuate wildly. The dips that can occur each month can be deeper and lower. And on average, the amount of estrogen floating around is less. So in the perimenopause, you can sort of look at it as replenishing your ovary. So you've already got some of your own, and it's just sort of topping it up. When you've been through the menopause and your ovaries have stopped making estrogen, then it's definitely replacing. So it's replenishing and it's replacing.
Okay, that's very helpful, Claire. It's really helped me to think about it in terms of that kind of two different things, replenishing and replacing. So when should women generally consider HRT as an option?
I think that's a really good question, because a lot of people think that they have to wait till they're bad enough or wait till they've stopped having periods altogether. But I think the answer to that question is when you feel that you need it. So when you start to feel that you're having some menopause symptoms, and that might be in the perimenopause, so you might start to feel a bit more frazzled, a bit anxious. You might be starting to have poor sleep because of hot flushes. I think when you are feeling affected by those symptoms, then that's a really good time to start it. I don't think that you feel that you'd have to wait. I don't feel you should have to, that you could be too young to start it, as again, some people do. And also in terms of the health benefits of HRT, so HRT helps reduce the risk of osteoporosis, it helps reduce the risk of fractures, and it helps reduce the risk of heart disease. So if you go through the menopause at a young age, for example, under the age of 40, it's really important that you start HRT almost straight away to reduce those risks as you gain years, as you enter older age. So the answer is when you feel that you need it, but if you have an early or a premature type of menopause, then it's really important that you get it sooner rather than later.
Okay, so I guess what you're saying is that definitely start to take it if you go through the menopause under the age of 40, and really think about taking it as soon as the onset of symptoms. So I guess what you're saying, Claire, there isn't any benefit to taking it later or to waiting to see if your symptoms get worse or if you can kind of cope or just manage them. Because I think that's something that we hear a lot. We've seen it in our research. I know you've mentioned you hear it from your patients. I've heard some of my friends say they don't think they're bad enough yet. So what would you think to that? Do we need to wait till things are really bad, or is there any benefit to doing that?
Honestly, I think it's why we say that menopause management is not one size fits all, because everybody's really different. There'll be some people who do want to see how it goes without HRT. There'll be people who, you know, want to just wait and see, and there'll be some people who don't. And I think you just have to consider what's right for you. You know, if waking up once a night is really mucking up your sleep, is making you feel dreadful the next day, so it's you feel that your performance is slipping, then that's the time to start it. Whereas somebody else might feel, oh no, well that's fine, I can manage. So it's so individual. It's impossible to generalize, except for younger women, obviously.
Yeah, thanks, Claire. Now, I know, you know, all of the content that you've written on our website, for each of the symptoms, you talk about the range of treatment options. And it felt to me, and, you know, as you were writing it and as I was reading it, that HRT is right for treating a range of options. Is it worth maybe calling out which symptoms in particular you see HRT benefiting?
Studies suggest that HRT is the most effective treatment for menopause symptoms for most women who can take it. So when the benefits outweigh the risks. I think it's difficult to say that it's more or less effective for individual symptoms. So HRT definitely is very effective for helping hot flushes. It can be effective in helping mood symptoms of the menopause. It can be effective in helping the cognitive symptoms, so the brain fog. It's so different. Every single woman I see has such a different range of symptoms. You want to say across the board it's probably effective, but probably the most evidence surrounds the psychological symptoms, the hot flushes. Some of the lesser known symptoms like burning mouth, like itching skin, for example, there's probably less evidence out there, but that doesn't mean that it's not effective.
Yeah, thanks, Claire. Now, as we record this blog, we're in the middle of Mental Health Week, and we're going to publish a blog from you, Claire, in a few days' time around the use of HRT in treating psychological symptoms of the menopause. So a couple of questions on this one. One, in your experience, how beneficial is HRT versus antidepressants when women have psychological experience, symptoms such as anxiety or depression as they go through the menopause? And the other is, one of the things that we hear is that HRT can increase the risk of depression. So it would be interesting to get your take on that. Is that fact or is that a myth?
Okay, so to take your first question, if your psychological symptoms, so if your low mood, if your increased anxiety is related to the loss of estrogen in the menopause, it's really likely that HRT is far more effective than starting an antidepressant. I see that time and time again in my clinic where people have been started on antidepressants, they've been misdiagnosed as suffering from anxiety or depression, but actually their symptoms are related to the perimenopause and menopause. So in my experience, the women that I'm seeing, HRT is effective, and it's probably more effective than taking an antidepressant. There will be women who suffer from clinical depression and clinical anxiety, and antidepressants are going to be one of the most important ways of managing their clinical symptoms. Those symptoms can get worse in the menopause as well, and HRT, it can help, but I think it's in women who really struggle with their mental health, I do think they sometimes need a discussion with a specialist, and it's hard to generalize from person to person. So for the vast majority of women, HRT won't make you feel more depressed or more anxious. Most people, I would say, feel better on it. There are, of course, always exceptions, and there may be a really small percentage of women actually who don't get on with taking estrogen. The progestogens are more tricky. If anything's going to pull your mood down, it can be the progestogen. And so the challenge there is to work to find the most appropriate type of progestogen that is less likely to cause side effects for you.
Great, thanks, Claire. That's really, really helpful and really clear. Now, one of the other questions that we seem to be getting a lot is around the different types of HRT that are out there. And in particular, women are asking, what does bioidentical mean, or body identical, and what's synthetic, and are some forms of HRT made from horse's urine or something? So they're hearing all these sorts of things. So it would be great to get the facts around that.
So bioidentical means that it's biochemically the same as hormones made by your ovaries. So bioidentical hormones, body identical hormones, they're two terms that are used to mean the same thing. So the vast majority of the estrogen that is prescribed is estradiol, and that's the same estrogen that is produced by the ovaries. You mentioned the horse urine estrogens, and they are still prescribed today, but that contains a mix of estrogens. It's not strictly bioidentical to humans, and it does come from the urine of pregnant mare horses. So yeah, it is from horses' urine. In terms of progestogens, bioidentical progestogen is micronized progesterone, and that's prescribed as a small capsule that you take at night because it can help you to sleep. So that's the bioidentical progestogen that's derived actually from plants. And all the other progestogens in the pills, in the combined patch, in the Mirena, for example, they are synthetic progestogens. So they're not exactly the same. They're similar, but they're not the same as our own hormones.
Okay, Claire, that's really, really helpful, because I remember when I first started researching in this, I got very confused between bioidentical and body identical. So it's good to know that they're, different terms, but they mean the same things, and that most of the HRT that's prescribed today is bioidentical or body identical. Now, one of the things that we hear a lot around is what does compounded mean when it comes? What's compounded bioidentical HRT and what's regulated? Be great if you could just give a quick explanation of that.
Yeah. So the hormones that I've just talked about are regulated, can be prescribed on an NHS prescription or a private prescription, types of hormones that are commonly prescribed up and down the country by GPs, by menopause specialists alike. Compounded HRT or compounded hormones are prescribed only by private clinics that are less regulated than the regulated hormones that I've just talked about. And that's where a blood test is taken, and then an attempt is made to match the hormones that are given to the results of the blood test. And I think the key thing is that they're only available, those types of hormones are only available privately and not as regulated as the conventional bio or body identical hormones.
Great. And Claire, I know you and the other doctors in our clinic only prescribe the regulated bioidentical hormones, not the compounded.
Yes, yeah, that's exactly right. It's not compounded bioidentical HRT, it's the regulated standard bioidentical HRT. Yeah, it's a bit
and it is very complicated, and that is what's recommended by the British Menopause Society as well, isn't it?
Yeah, no, that's absolutely right.
Claire, thanks very much for that. That was really, really helpful. We've more questions to go through, and we'll cover those over the next few weeks. In the meanwhile, if you have any other questions, please do get in touch with us at hello@mymenopausecentre.com or DM us on Instagram. We've got lots more information on HRT and on the symptoms of the menopause and how to treat them on our website. That's www.mymenopausecentre.com. And we really hope that you find the information there of use and of help. Claire is going to be publishing a blog on HRT and its use in treating the mental symptoms of the menopause as well. And that will be going live over the next couple of days. Thank you.